Sir, whether to choose MD or a DNB. So I'm getting MD in a periphery state college, I'm getting DNB in a tier 1 or a tier 2 city. Which one should I choose? Because still people think that maybe MD is superior, DNB is inferior. Say MD pediatrics in a peripheral state college and DNB medicine in a tier 1 city in a good corporate hospital.
Medical subjects.
Yeah.
Like medicine, pediatrics, psychiatry.
Especially surgical specialities, the hands-on experience that they get in a DNB institute, so going abroad. So many students do fellowship outside India, USMLE Step 1s or FRCR or UK exams, Australian exams. Hello everyone, so welcome to another video. Now in this video, we'll talk about the most important question that students ask us in the DMs is, sir, whether to choose MD or a DNB. So I'm getting MD in a periphery state college, I'm getting DNB in a tier 1 or a tier 2 city. Which one should I choose? Because still people think that maybe MD is superior, DNB is inferior. So in this video, we'll declutter all your doubts. We will debunk all the theories that are around DNB and MD, and hopefully this video will help you make an informed decision for your NEET PG counseling. Now, I'm very glad to introduce Dr. Santhosh, who is our medicine faculty at PW MedEd, and we both will be decluttering this whole puzzle about MD versus DNB. So, Santhosh sir, what is your take on this?
Okay, so first point, by the gazetted notifications and by principle, the NMC Act itself equates DNB and MD degrees for all practical purpose except academics, which we will be talking about more on a later stage. So because the gazette itself equates both of them, there are some nuanced decisions to be made while choosing the branches. Otherwise, practically they're equal. So we'll delve into that, the nuances which will help you to make better choices. So I have a question, Dr. Rishabh. Many students have DM'd me saying that I'm getting an MD in a branch which is not my first choice, and I'm getting DNB in a branch which is my first choice. So in such situations, what do you recommend?
So first of all, now that we have made it clear that DNB is equal to MD for all official practical purposes, be it your jobs, be it your fellowships, SRships for DNB, I would still say that always choose branch over MD. Okay, branch over MD should be your mantra. This should be ingrained in your mind that branch over MD. MD is ऐसा कोई सोने का चिड़िया नहीं है कि MD से आपकी life better हो जाएगी कि you'll get more opportunities. No, always choose branch over MD. Okay, this is true for almost all branches, be it medical or surgical. Now the next question that I would like to ask you, sir, in which scenarios, let's say there is a scenario in which a student has narrowed down his two choices. So he or she likes medicine and pediatrics both, and he's getting, let's say, MD pediatrics in a peripheral state college and DNB medicine in a tier 1 city in a good corporate hospital. Then what should he choose? He likes both medicine and pediatrics.
Okay, so I presume that the students are liking medicine and pediatrics equally.
Yeah.
Otherwise, if they're liking one over the other, then the previous answer
DNB
solves their doubt. So if they're liking both equally, then I would say in terms of choosing the degree, I would say choose MD, because as you know, there is a better public perception of MD. So they can definitely go ahead with MD pediatrics over DNB medicine. But obviously when we make decisions, there are other factors which come into picture. So if the MD is positioned peripherally and DNB they are getting in a metro, and there are family compulsions or other issues for them to stay in a metro city, then I would say choose DNB medicine. So like DNB medicine, I won't count it as an inferior choice to MD pediatrics. But if you're equally considering both the possibilities, you're okay to go to periphery, you're okay to stay in a metro city, and you're okay with pediatrics, you're equally okay with medicine, in such cases, I would say choose MD pediatrics.
Right. Okay. So you have said that branch over MD anytime. And if you like the same branches equally, then definitely MD over DNB, depending upon your case scenario. Obviously, if you prefer staying closer to family and that city is offering you DNB, then you go ahead with DNB. Now, in which scenarios is DNB a slightly disadvantage as compared to MD? So I think to start with, because I've seen residents in both the specialities, what people usually tell me is that for especially surgical specialities, the hands-on experience that they get in a DNB institute is little less as compared to, let's say, an MD from a peripheral college. What is the other side to this argument?
Okay, so when it comes to medical subjects,
Yeah.
like medicine, pediatrics, psychiatry, I won't say, or I can't say that there is significant decrease in exposure for the medical subjects. So you get even better exposure in DNB institutes in comparison to certain peripherally located, especially private medical colleges. Because the patient flow in all the medical colleges, as you
not
know,
the
medical
same.
colleges have
Yeah.
increased like anything.
Yeah.
So the patient flow has decreased. But the corporate hospitals still maintain decent patient flow. Though you may not get an absolute freedom to
Take decisions.
decisions, but if you are someone who is ready to observe your seniors or your consultants making the right choices, or even if they're not making the right choices, you have the resources to compare the standard practice, you get to learn. So exposure wise, there is no dearth of exposure in the DNB institutes today, and that definitely also exposes you to the corporate culture, because as you know, paisa to corporate world mein hai, there is less money in the government work or in the academic field, and most of us need to make money for the ends to meet. So I would say medical branches DNB doesn't carry much cons, except that exam may be challenging. You're giving exam in a center where you know nobody. But otherwise, in terms of your 3 years of time spent in residency, I would count them
Equal.
quite similar. Yeah.
For the surgical specialties, I would also like to add that, let's say, even in a corporate hospital where you're doing your DNB, the per se cutting or your hands-on exposure might be less, but then you get exposed to a variety of surgeries, because in good corporate hospitals in Tier 1, there are good surgeons, good super specialists who are operating. So you do get to see the latest technology, the latest surgical expertise that is going on presently in the surgical field. So your hands-on exposure might be less, but your overall exposure of the field will be much bigger. And this is the same as that of central institutes. So for example, AIIMS, PGI, these are central institutes. Here also the MDs, here also the MS do not get as much exposure to surgery, hands-on exposure, or what you call cutting, as someone from your state medical college. But again, the variety of surgeries that they see is much more, and hence they're able to choose, which surgical subspecialty they want to super specialize in. So again, the exposure to surgery is sort of counterbalanced by your cutting exposure in your DNB. One lacunae of a DNB program in India currently is the passing percentage, which bothers a lot of students, and this is especially general surgery, orthopedics, obs and gynae, in which the passing percentage is very low. Now, this is not true for medical specialties, radio, derma, psyche, pediatrics, in which the passing percentage is increasing year on year. But this is one thing that you can take into consideration. Now, any other point regarding MD versus DNB, sir?
So there are a few points regarding the passing percentage. One of the standard reason for low passing percentage for several decades with the NBA was, earlier the choice of DNB was made by those students who couldn't crack the NEET PG several years, like 3, 4, 5 attempts, and then they used to resort to getting into the DNB. But now we are seeing increasing passing percentage, especially with medical branches. The main reason is the bright students are now making informed choice. They are choosing branch over the
MD.
MD degree, and because of that, they are passionate.
Yeah.
Wherever we carry our passion, we
That
will
is
sail
true.
through.
That is
We will
true,
not have much difficulty to sail through. And today, resources are also abundant. Back then, 10, 15 years back, except Harrison, there was no other source for medicine. If you're not able to understand Harrison, you don't have any guide to declutter it for you, then you're lost.
Yeah.
But today, in the world of social media, there are plenty of resources where you can, even if you are not getting exposed, or if there is no mentor in your institute, you can still find a solution for your problems and continue learning. And because of that, the result is increasing. So I would still vouch for most of the students, it is branch over the degree. Choose your branch, because if you love the branch, you will find ways to sail through it. Passing percentage for today's generation of students shouldn't bother much.
Yeah, the one last point that I want to make regarding MD and DNB is regarding your academics and government jobs. So for if you're, hell bent that I want to continue in a government job later on, become an assistant professor in a medical college, then yes, the MD students do have an edge over DNB students, because there is still a bias among the academia about MD versus DNB. So they prefer MD students over DNB still, be it your assistant professor and even your SRship at in government hospitals. So that is one consideration. But if you're, thinking of doing your own private practice post your post graduation, or joining a private hospital or a corporate hospital, then frankly there is absolutely no difference between MD or DNB. So I think just to summarize everything,
that brings one question to me.
yes, sir.
Out of the fixed number of PG candidates who pass out.
Yeah.
Means MD plus DNB of any specialty. How many of them are absorbed into medical colleges and how many of them go into practice?
Majority are going into practice.
Right? So
Yeah.
for majority, I think
It
the
doesn't matter.
DNB, MD doesn't
Yeah.
matter.
Yeah.
So until and unless someone is extremely inclined that I will spend most part of my life teaching medical students in a medical college, it shouldn't matter whether it is MD or DNB.
DNB, right? Sir, absolutely right. And another point that I want to make clear that with regards to going abroad, so many students do fellowship outside India, USMLE Step 1s or FRCR or UK exams, Australian exams. Again, MD versus DNB doesn't matter. Both are treated equally. So that part is also pretty clear. So if we were to summarize everything, sir, what are the cons of DNB if you were to say that maybe a low passing percentage in surgical specialities, academic post medical colleges, research positions you want to see, maybe MD over DNB, and with regards to surgical hands-on or cutting that we call it, in surgical specialty during your MD maybe the cutting will be less as compared to a state medical college.
Yeah, I think you've summarized all the key points that students need to take into account before making a choice. Students, hopefully our discussion has helped you to make an informed choice and we wish you all the best for your career.
All the very best.
All the very best.